Alright, team. We have a patient presenting with 12-hydroxyacylcitranoic acid rhinitis and inflammation. What are your thoughts on the diagnosis?
Could it be Church-Strauss syndrome?
I'm leaning more towards granulomatosis with polyangiitis.
I think it might be eosinophilic granulomatosis with polyangiitis.
What about chronic rhinosinusitis with nasal polyps?
No, no, and no. It is Crevaille-Hire, Baumgarten disease.
But sir, that's such a rare condition. Are you sure?
I'm positive. And we don't have time to waste. We need to perform a coccygectomy immediately.
But Dr. Hawks, that procedure is extremely risky. Are you sure it's the right course of action?
I know it's risky, but it's our only chance to save the patient. We have to go through with it.
I trust your judgment, Dr. Hawks. Let's get ready for the surgery.
I'll prepare the operating room. Let's do this, team.
Tracy, I need to perform a coccygectomy on my patient. I'm certain they have Crevaille-Hire, Baumgarten disease.
Hawks, hold on. Have you considered all the risks and possible alternative treatments?
I've been practicing medicine for years, Tracy. I know what I'm doing. Stop questioning me.
I'm not trying to undermine your expertise, Hawks. But let's not forget your track record of misdiagnoses.
That was one time, Tracy. One time. This is different. I know this is the right course of action.
I just want to make sure we're doing what's best for the patient. Let's discuss it further before making any decisions.
Leslie, I just checked on the patient and the news isn't good. They are in critical condition.
Oh no, that's terrible. What are we going to do?
I think we need to talk to Hawks and let him know that the coccygectomy was not the correct treatment for Crevaille-Hire Baumgarten disease. He needs to be informed so we can explore other options.
I understand your concern, Frank, but right now our priority should be the patient. We need to focus on providing the best care and support we can. Hawks will understand once we explain the situation to him.
You're right, Leslie. Let's make sure the patient gets the care they need first.
We can deal with informing Hawks later. Our main focus should be on helping the patient through this critical moment.
What the hell were you all thinking? You nearly killed the patient with your incompetence.
I still believe it was a pilonidal cyst, not coccydynia.
I don't know, I was leaning towards sacroiliitis. It was a tough call.
I thought it was a fractured coccyx. How were we supposed to know for sure?
We thought it was a case of coccydynia, Dr. Hawks. It was a difficult diagnosis.
You all are a bunch of quacks. It was a simple case of coccygeal fracture and you chose the wrong procedure. Pathetic. Besides, you can't even all agree whether you thought it was coccydynia or not. Why do you speak for the entire team, Gary?
Yeah, that's rather reckless, man.
It's probably from his short time working at Chuck E. Cheese, where he convinced a bunch of kids to jump the mouse at the same time so he could steal their tickets.
That's weirdly specific, Randall.
How would you even know that?
Randall was the mouse.
What on God's scorched earth am I even hearing right now? Shut up and fix your goddamn mistakes. So, Johnson, how's everything going outside of work? Any exciting plans for the weekend?
Oh, you know, the usual. Just trying to relax and spend some time with the family. How about you, Hawks?
Not much going on for me. Just been diving deep into this case we have. It's quite perplexing.
Oh, the case with Mrs. Harrison? She's been a tough one for sure.
Yes, but I think I finally cracked it. It all makes sense now. I need to go check on something. See you later, Johnson.
Wait, you're leaving already? What about lunch?
Sorry, had to go. I'll catch up with you later. I have a new diagnosis for the patient. It's not Crevaille-Hire or Baumgarten disease. It's ectrodactyly.
Hawks, what are you doing storming in here without proper protective gear?
This is an operating room, Hawks. You can't just barge in like that.
Yeah, you're putting everyone at risk with your reckless behavior.
Listen, I know what I'm talking about. The prognosis for ectrodactyly is challenging but manageable.
Challenging how? What are the treatment options?
Surgical interventions to improve hand and foot function, along with therapy for physical and emotional support.
Well, I guess we should start preparing for the new treatment plan then.
Hawks, next time, please follow protocol. Lives are at stake here.
Tracy, I finally nailed the right diagnosis for the patient.
That's great news, Hawks. Congratulations on getting it right.
Yeah, well, it wouldn't have been an issue if I didn't have such idiotic doctors on my team.
Hold on. What do you mean by that? You were the one who initially misdiagnosed the patient.
Well, my diagnostics team could have caught it sooner if they were more competent.
Hawks, you can't just shift the blame like that. You made the wrong call first.
Stands up abruptly. I don't have time for this, Tracy. I have patients to attend to.